So the Ballmer Institute is based at the University of Oregon, and our mission is to expand access to mental health services for kids and families. So we know that the need for mental health support among kids has gone up dramatically over the past couple of decades, while the number of providers who are trained to provide the kinds of support that kids and families need has been relatively static over time, and in some cases has even gone down. And so this, huge gap between the need for support among kids and the availability of a workforce who can provide that support is what led to the launch of the Ballmer Institute. Our mission is to increase and help to expand the workforce of providers who can deliver evidence-based, high quality, culturally responsive supports to kids and families. So we are approaching that in a couple of ways. So we're housed at a university. The way we approach that is training programs. The most innovative aspect of our work is our undergraduate program in child behavioral health. It's the first of its kind in the country, but is sort of rooted in models that have been developed effectively in other countries like the UK that focuses on a bachelor's level profession in youth behavioral health. And what that means is that our training program is providing students with skills and how to provide high quality support to kids in community settings like schools, pediatricians' offices, community-based organizations at the bachelor's level. And this is really novel because historically in this country, you've needed to go to graduate school to get a master's degree or a PhD to get that kind of training. And so our program is providing the kinds of training that's historically only been available in those graduate degree programs at the bachelor's level. And the goal is to help grow the workforce, to get more folks trained in the kinds of skills that we know help kids and families, and to get them out into the workforce sooner. I would say a second piece of that training program that's really novel is that our emphasis is really on early identification and prevention. So right now in our mental health system, many kids and families who need support never get it. And if they get support, it's, at the point at which the problem has really become pretty severe and impairing. The focus of this new bachelor's level profession that we're creating, the child behavioral health specialist, is to help identify kids who are starting to struggle at an earlier point in time and to deliver kind of brief, early interventions that might prevent those problems from worsening over time by building skills, building resilience, and helping kids build healthy relationships with the adults in their life to, prevent mental health problems from emerging or from worsening over time.
And how long has the University of Oregon had the Ballmer Institute?
So the Ballmer Institute was launched in 2022 with a transformational gift from Connie and Steve Ballmer. And the undergraduate training program, the Child Behavioral Health Training Program, began its development immediately after the gift landed in 2022. This year, the fall of 2024 is when we welcomed our first cohort of students into the program. They have now finished their first year in the program, and they will be, when they join us, they're juniors. So they've already had a couple of years of college. They're doing their general ed requirements. When they come to us, they spend the last 2 years of college at our campus in Northeast Portland, taking all of their courses, doing all of their training just with the Ballmer Institute. So our first cohort of students just finished their junior year. They'll be seniors this fall, and they'll be graduating in June of 2026. We've got our second cohort of juniors joining this fall as well. So fall 2024 was a big milestone for us when we transitioned from kind of thinking about the program, designing the program, to actually delivering the program. And so we've got about 20 students in our first cohort as part of their training. And the thing that's really unique about this kind of training at the bachelor's level is that they're not just taking classes where they're learning how to deliver interventions and, work with kids and families, but they spend 700 hours of their time over those 2 years with us out in the community. Learning how to deliver interventions and provide support to kids and families under the supervision of folks who are licensed mental health providers, including our faculty. So as juniors, all of our students spent time in Portland area public schools and K-12 schools, working with kids, integrating with school mental health teams and with teachers to identify kids who are struggling and deliver needed supports. And as they enter their senior year with us, they'll be entering a whole range of different community settings that have partnered with us to help train students. So some of these are mental health service settings, some are community-based organizations that provide culturally specific services. Some are pediatrics settings that also provide behavioral health supports to kids and families. And so part of their training is really out there in the Portland community, learning how to do this work by working with kids and families in our region.
And I know you may not know, but is there any data to kind of support the work that's being done as far as lower suicide rates or just lower, I'm not sure, crimes associated with mental illnesses because there are basically more mental health workers out in the community?
It's a great question. I'd say there's a number of sort of pieces of evidence we can look to. First, we know that um, we have a whole suite of what we call evidence-based interventions that when kids get access to them, it reduces depression, anxiety, substance use, suicide, crime rates. It helps kids improve in terms of their academic performance. They do better in the job market later in life when they have access to these interventions. And these interventions are really the backbone of our training program, where we are training our students to deliver the interventions that we know work to help reduce mental health problems in kids and improve their wellness and improve their functioning. But the sad news is most kids never get access to those interventions. So we know currently, all across the country and in Oregon in particular, less than half of kids who need mental health support receive any at all. And even fewer receive the kinds of interventions that we know work, the kinds of interventions that science has shown are effective at reducing mental health problems. And that's really kind of one of the primary drivers of our mission. How do we get more people trained in those interventions that we know work to improve mental health for kids? And then how can we get those folks out into the community and places where it's easy for families to access care, like at a school, at their pediatrician's office, at a boys and girls club, or a community-based organization where their child might already have a mentor or be receiving other services? How can we ensure that there are folks in those settings who can identify the kids who are struggling and make sure they have access to these interventions that we know work? The second thing I'll say is people sometimes have questions about why a bachelor's level profession, right? One is we know that by providing this training at the bachelor's level, we're reducing barriers to entry. It's a huge barrier to require folks go and pay for an expensive graduate degree, like a master's degree, to get into this field. And we know that mental health jobs don't often pay that well, right? It might not be a good investment for you to pay a lot of money for that degree if you're not going to earn a salary on the other side that makes it easy to pay those student loans. It's often free to go get your PhD, but that means you've got to spend 10 years basically, getting your training. That's really inaccessible to lots of folks. And those programs admit very, very few students because it's very expensive for universities to train people at that level. And so, interestingly, in the UK, about 10 or 15 years ago, they were really the leaders of thinking about using bachelor's level providers as kind of the first line of support when folks need mental health care. And in the National Health Service in the UK, they've integrated bachelor's level providers, what they call this kind of low intensity workforce. A lot of folks, when they first come to the National Health Service saying they need help for a mental health problem, they see someone at the bachelor's level. And they're trained to do a number of things that are kind of these low intensity interventions and to monitor to see, hey, is this person improving or are they getting worse? And if they're not improving, then they'll, refer them to someone who has more training. But what they've shown is that about a third of people never need to go see that more highly trained professional, that the bachelor's level provider can provide a support that's effective for a huge proportion of people who need help, and that the interventions that are being delivered by these bachelor's level providers are effective, that people's rates of depression and anxiety and suicidal thoughts go down when they receive these interventions. And so even though this is really novel in the US, we've never tried this here, we've got really good evidence from other contexts that folks who are trained at the bachelor's level can do this work effectively.
Thank you. That was very informative. Um, as far as in the Eugene or the Lane County area, are you aware of any community programs or bachelor students that come down here and do any work?
Well, it's a great question. So the University of Oregon has another training program called Family and Human Services that's actually been around for a long time that provides a slightly different kind of training to students at the undergraduate level to work in community settings with both kids and with families to do sort of care coordination, prevention-oriented services. It's a little bit different in focus. It's not so squarely focused on delivering mental health services, but it is focused on providing bachelor's level students with training in how to kind of work out in the community and get the training experiences that often haven't been available to students in undergraduate programs. I'd be happy to connect you with Jen Doty, who's the faculty member that runs that program at the University of Oregon, if you'd be interested in talking with her more about that. And that is a Eugene-based program, unlike our child behavioral health program, which is based in Portland.
Okay, yeah, I would love that. As far as your goals or your ambitions, do you hope or plan or know of if this will ever reach the federal level? I know that in Nevada they passed the same bill so that they can have a similar program. Are you hoping that this will kind of catch like a fire and become nationwide?
That's the hope, right? So, we're sort of in the phase of our work that has been really focused locally in Oregon of building the best possible training program we can, making sure our students are getting amazing training, that we get them jobs in the community where they can help kids and families. But as we've now kind of lifted that first phase of our work, the next phase is really thinking about exactly that. How do we bring this to scale? How do we serve at the University of Oregon as a national model for how to train a new workforce that can expand access to services for kids and ensure that more kids get the support they need? Nevada is really kind of the first place that's really moving to that stage of replicating what we're doing here in Oregon. There are three universities in Nevada that are going to be building undergraduate programs modeled after this program we built at the University of Oregon. The state has created a credential or a license for those folks to be able to practice and deliver services in the community when they graduate, something that we are actively working on here in Oregon as well. And so it's starting to happen, right? It's catching on. And our hope is that, just like you said, this really sparks something, that begins really a movement to think about how this new bachelor's level profession can really meet the needs of kids and families in this moment that, many national organizations and leading experts have called a youth mental health crisis. We need to think differently about how we train providers and get kids and families the support they need. And we really see this new profession as one of a whole host of ways that we can do that.
And do you know of any students? Well, no one's graduated yet, but know of any students that have ambitions to come to Lane County to potentially be a school counselor um, or anything like that?
It's a great question. And, we know that all of our students are excited about entering the workforce to work in schools, to work in pediatrics, to work in community-based organizations when they graduate. None of them have graduated yet, so we don't know where they're going to get those jobs. But I would suspect, most of our students spent the first 2 years in Eugene, doing their general ed coursework and their prereqs at the University of Oregon. Some of our students started at community colleges and then transferred into our program for the last 2 years, and we're really actively building pathways to make that as easy as possible. But I know some of our students are actually from Eugene, so I suspect some will be returning to Lane County. I'd be happy to put out some feelers if you'd like to talk to a student who might be interested in coming back to Lane County when they graduate to do work, if that would be of interest for your story.
Yeah, absolutely.
Yeah.
Is
It's
there
summer,
any?
so I'll be honest, the students aren't always the most responsive to emails, but I will put out some feelers. I will, yeah, connect you to someone if any of them, are interested in going back to Lane County when they graduate.
Okay, sounds good. Is there anything that I missed or anything you just like viewers to know?
I think that I'll sort of leave with, building something like this, creating a new workforce really requires a coalition that, this work started at the University of Oregon, but it now involves stakeholders from all over the state, whether it's pediatricians who want to better serve the kids and families who are coming into their office for services, whether it's legislators and policymakers who want to see more kids get access to the services they need, schools who want to, increase their ability to serve, identify kids who are struggling and support their mental health in the context of schools. That it really takes people in all of these sectors to make this happen. And so the training program is here at the University of Oregon, but this work really involves people from all over the state who care about kids and who want to um, see us do a better job in terms of meeting their needs for support.